Hello everyone, I'm Anas Al Ubaidi and welcome to this session or lecture that is about building a CMAA Certified Medical Administrative Assistant Career Framework for Leadership and Specialization, which is part of the chapter that is about foundations of excellence in healthcare uh, administration. And of course, this lecture or session is part of the Certified Medical Administrative Assistant course program by ACMSO. Introduction. As a Certified Medical Administrative Assistant CMAA, your career can go far beyond the traditional expectations of appointment scheduling and medical coding, which here we are reflecting on the growth opportunities, the dynamic growth opportunities that the MAA position can offer. The healthcare landscape is growing to demand leaders who can manage operations, streamline administrative processes, and act as consultants in specialized practice areas. Building a career framework focused on leadership and specialization equips CMAA certified medical administrative assistants with the tools to move upward professionally, taking on responsibilities that influence patient outcomes, healthcare workflows, and organizational success. Key points will start with the key point here as uh, defining your career vision. What does entails? Uh, what it entails? Take time to define long-term goals. Do you see yourself working in a surgical practice as a billing and compliance expert, managing administrative teams in a healthcare organization, or becoming a consultant for medical practices seeking operational efficiency? How to do it? Assess your passions and interests. In other words, i.e., are you drawn to patient experience, staff management, or financial analytics? Research job descriptions for advanced roles like healthcare operations managers or consultants to understand qualifications. Develop a timeline with well thought out milestones, short term 1 to 2 years, mid-term 3 to 5 years, and long term 5 plus years. Scenario: if you're interested in quality assurance, identify tasks like auditing patient records for billing errors or adherence to privacy laws and focus your learning on those areas. And here is a diagram on mapping your career pathways. Skills development, another key point here, core administrative skills start by mastering essential CMAA responsibilities, including medical terminology, billing codes, and compliance with HIPAA and other regulations. Soft skills and leadership, areas like conflict resolution, team collaboration, and public speaking become essential for managing staff or working as a consultant. Specialized skills develop expertise in NICA areas such as insurance claims processing, compliance auditing, um, or project management. Resources enroll in leadership training programs or project management courses designed for healthcare professionals. Learn technical tools like electronic health records, EHR software, financial management systems, and analytics platforms. And here is a diagram on administrative and leadership skills. Another key point here, certifications and continuing education. Why it matters. Certifications enhance credibility and demonstrate continued commitment to excellence. Key certifications to pursue: Certified Healthcare Financial Professional, for instance, for short CHFP, for Revenue Cycle Specialist, Project Management Professional, PMP, for operational management and leadership roles, HIPAA compliance certification for roles in privacy and legal compliance. Strategy combines certifications with practical application in your current role, i.e., if you are pursuing CHFP, for instance, Certified Healthcare Financial Professional, volunteer to manage billing accuracy projects within the office. And here is a diagram on enhancing professional credibility. Another key point: networking to build influence. Importance of networking. Building connections with industry professionals opens doors to mentorship, advanced roles, and consulting opportunities. Where to network, join professional organizations like the American Association of Medical Assistants, AAMA, attend healthcare administration conferences that focus on the latest trends and innovations, participate in online webinars or discussion forums. Proactive steps: reach out to leaders on LinkedIn by commenting on their posts or offering insights on relevant issues. Networking is not just about access, but adding value to relationships. Here's a diagram on leveraging networking for career advancement and influence. Another key point here: leadership strategies. Becoming a leader. Seek small leadership roles within your current position, i.e., spearheading efforts to streamline appointment scheduling or leading a team auditing patient intake procedures. Team management and delegation. Learn to delegate effectively to encourage accountability within your team. Use leadership books, podcasts, and case studies as tools. Vision. Drive change by proposing solutions to enhance workflows, reduce overhead costs, or improve patient satisfaction metrics. Another key point: exploring specialized roles, consulting roles. Use your expertise to help practices optimize billing, reduce compliance liabilities, and improve workflow efficiency. Operations management. Oversee the administrative functioning of a clinical or hospital department, focusing on performance improvement. Specializations. Develop expertise in fields like oncology, administrative support, pediatric care management, or surgical practice operations. We have 10 application examples here. Example 1, for instance, establishing leadership in patient intake workflow optimization. Example 2, transitioning to a compliance specialist role. Example 3, leading revenue cycle management projects. Example 4, advancing public health initiatives. Example 5, streamlining medical office scheduling. Example 6, enhancing staff collaboration. Example 7 would be leading practice expansion efforts. Example 8, coordinating a multi-department workflow integration. Example 9, revamping a clinical scheduling system. And then example 10, developing a patient education program. And for each example, we'll have scenario itself, the steps taken, resources and tools, and then the impact. Summary tables next. We have table here on defining a career vision, table on skills development for leadership and specialization, table on certifications for career advancements, table on leadership strategies for CMAA career, table on application, IES for practical career growth, and then MCQs or multiple choice questions in order to revise what we have covered through this lecture. Question 1, which certification focuses on mastering financial operations and revenue cycle management in healthcare? The most appropriate answer would be B, Certified Healthcare Financial Professional, CHFP. Question 2, what is the primary goal of implementing a workflow analysis and patient check-in optimization? Also, the most appropriate answer, the same B as well. Identify bottlenecks causing delays in check-in processes. So the goal of a workflow analysis is to pinpoint inefficiencies such as bottlenecks and address them by identifying these areas. A CMAA, Certified Medical Administrative Assistant, can propose solutions like self-check-in kiosk or SOPs, standardized operating procedures for smoother operations. Question 3, when leading a compliance project, what should always be included to ensure HIPAA standards are met? A is the most appropriate answer: training staff on secure communication protocols, as training staff in secure communication is essential for maintaining compliance with HIPAA regulations. Question 4, why is hosting training sessions a valuable leadership strategy for CMAAs? The most appropriate answer, B, it builds recognition as a resourceful leader within the organization, as hosting training sessions highlights a CMAA's expertise, positioning them as a reliable leader and mentor. Question 5, what is a critical first step when coordinating a practice expansion project? Would be C, the most appropriate answer, researching legal and organizational processes for expansion, as understanding the legal and organizational aspects of starting a new clinical ensures of starting a new clinic ensures compliance and smoother operations. And here we come to end of this lecture. Thank you very much and goodbye.